Hi, I'm just going to present the common eye diseases which for which the ophthalmologists are not so commonly concerned. Okay. First we start with refractive errors. There are different types of refractive errors which are myopia, hypermetropia, astigmatism and presbyopia. Basically these occur because of the change in the shape and size of the eyeball. In hypermetropia, it is also known as farsightedness, where the distance vision is more and the near vision is less. It occurs because of shortening of the eyeball, wherein the image that is supposed to be formed on the retina is formed at a point which is behind the retina. In myopia, which is also called as close-sightedness, the vision for near is fine, but the distance vision is affected, and it occurs because of elongation of the eyeball. So the image is formed in front of the retina. Also, there is astigmatism, wherein instead of forming an image at a point focus, the image is formed at several points, which causes the image to lose its distinction and become blurred. And there is a condition known as presbyopia, which occurs after 40 years of age, which is due to weakening of the muscles of the eye, and there is difficulty in near sight. The symptoms and signs are there is diminution of vision for distance or near depending on the condition. Patients complain of headache, eye strain, watering, and repeated infections like repeated boils in the eye which are not healing. The treatment consists of spectacles, contact lenses, and now we have refractive surgery known as LASIK. LASIK is laser correction of the refractive power of the eye, in which the cornea of the eye is reshaped so that the number is demolished. It is usually recommended after 18 years of age, wherein the number has remained constant. There are no other eye diseases present, and there are certain pre-LASIK tests which are to be done for screening, like corneal topography, which is to see the shape of the cornea, the thickness of the cornea, the intraocular pressure, etc. And earlier there were a lot of complications which used to occur like glare and halos, but now with onset of newer machines and there are fewer complications which occur. These are just showing the steps of LASIK, wherein small flap thickness of cornea is elevated, laser is done, and then the flap is replaced. So basically there is no opening of the eye that is occurring. Okay, second most common cause is redness of the eye. Now redness can be due to various causes. Most commonly it's because of conjunctivitis, which can again be due to various organisms like bacteria, virus, or it can be allergic. Second is uveitis, wherein there is an inflammation. It's not actually an infection, but it's sort of a reaction to the infection or something else. And there is dryness of the eye and traumatic. This is just a difference between traumatic and infectious redness of the eye. Okay. The common mistakes that are made when the patient is complaining of redness is patient usually goes to a general practitioner or just takes drugs from the medical store. That I have redness of the eye, give me some drops. The general practitioners usually prescribe antibiotics or steroids. Steroids are not useful in all conditions because steroids in case of infections can increase the symptoms and increase the complications that are occurring. Also, injudicious use of steroids cause a lot of side effects like cataracts and glaucoma. So it's better that you take treatment from an ophthalmologist. Second most common mistake is that patient, once they start putting the drops, they feel better after 1 or 2 days, so they stop using the drops. And then they come back saying that my condition has worsened now. But please continue the drops and complete the course of treatment that has been prescribed by the ophthalmologist and do not stop midway. A new entity which has come up is computer vision syndrome. This is because of use of computers for long hours in the day. And the signs are tiredness of eyes, eye headache, redness, watering, irritation, and eye strain, if these which may lead to refractive errors. The treatment for this condition is that there should be adequate blinking of the eyes, because most commonly it is due to evaporation of tears. We do not blink the eyes adequately while we are staring at the computer screen, which causes evaporation of tears and increase in dryness. This can cause also blinking of the eyes and increase irritation of the eyes. Every 1 or 2 minutes you should take, every 30 or 40 minutes, a break of 1 or 2 minutes should be taken to stare at a distant object and then come back to the screen, because just staring at a screen for long amounts of time causes sort of jamming of muscles of the eye. So you have to change the focus of the eye so that the muscles are balanced. Second, you should read and read in good light. Please do not keep the room lights off or do not use the computer or TV while with the room lights off or in dim lights. Then, if the air condition or fan drafts are coming directly into the eye, please adjust your seat so that the air conditioning is not causing the increased dryness, because the air tends to blow away and dry up the eyes. Okay. Secondly, another thing that can be done is lubricating drops can be used, but these are very temporary methods. Lubricating cannot be used lifelong forever. So you have to keep blinking your eyes and avoid. One more common mistake is that patients come to me and say that I splash my eyes with water a lot of time, but why am I still having the dryness? But splashing of eyes with water is causing diluting of the tears, which is worsening your condition. So splashing of eyes with water is not advisable. Another common problem